So globally, as of 8 a.m. this morning, there have been 17,392 cases reported of the novel coronavirus, of which 17,205 were in China. There have been a total of 362 deaths. One was in a Chinese national who was in the Philippines at the time. 142 cases in Asia and Oceania, 5 in the Middle East, 25 in Europe, 11 in the United States, and 4 in Canada, 3 of which are in Ontario, as you know. So in terms of the cases in Ontario or the investigations, as of 10 this morning, 108 tests have been conducted. Of them, as you know, 3 are positive, 2 in Toronto, 1 in London Middlesex. 76 are negative. We have 3 presumptive negatives and 26 which have results pending.
Be clear, in order to even get to the airport, you have to be screened. In order to get inside the airport, you have to be screened by Chinese authorities. In order to get on the plane, you have to be screened. So there's a number of screens taking place before you even get on the plane. And then you're monitored throughout the flight, and then as soon as you get off, you're screened again. And anyone with symptoms and during that time will be seen through our normal quarantine process, et cetera, et cetera. So this is more rigorous than people in past flights from Wuhan or indirectly undertake on that, but that's the extra precautions that we're undertaking at this time. And you've heard that they're planning, at least the federal authorities announced, that they're going to have them remain at the point of entry for a 14-day period. We're trying to get the details of how that's going to be worked out. What does that mean? Because remember, these individuals are not only from Ontario. They're from various places in the country. And a number of things have to be worked out, information, material, wider health information, healthcare coverage, all those logistics that we really don't know right now. It takes some time to get all that put together, to understand the unique challenge and issues that they may want to be dealt with, because there may be other health issues, other personal issues, other mental health issues that maybe we have to deal with. And we want to make sure the care is comprehensive and empathetic and sensitive to that and is respecting privacy. So how that's going to be all worked out, what kind of support services, working with our federal authorities, because it is a federal military base, and so there's jurisdictional responsibilities, making sure there's partnership between the federal government and the province, and then of course there's going to have to be with the other provinces if and then that time when there is movement back into the respective jurisdictions, meeting all standards and guidelines that we're trying to work through, myself with our Chief Public Health Officer of Canada, through our Special Advisory Committee, which has a fellow Chief Medical Officer of Health on it, so that there's consistency throughout the whole response.
The vast majority of persons under investigation meet the case definition, which has said that they'd have to have been in Hubei Province within the past 14 days and have fever and or cough. There are a small number, as Dr. Williams indicated, who came from other parts of China and have symptoms, and the clinician, the physician taking care of the patient felt there was concern and wanted the corona testing done in consultation with the lab.
Just wasn't clear.
The only one we're just, Rob, on there is that there could be those other, we're trying to get finalized with those other people that were contacts of a case. That's one on the flight, and we know they've all been followed, and whether any of them have been sampled or not, so far anyone who's been sampled has been negative, but we want to make sure we've got all that closed off there. But some are just being monitored at this time because they still remain asymptomatic as far as we know.
Are any currently under investigation still part of that original plane?
The one with the case on it?
The first case.
All we know is that we've been reassured that the ones in the area around that are concerning were notified, and are being followed, and anyone who had any concerns, they would be tested. But so far we have had no issues raised by local public health departments that are following along with these individuals at this time.
The last time you gave an update, you were talking about that period there where someone can have a very low level of the virus in their system, but not be fully clear. And at that point it was unclear as to whether or not the virus could fully be cleared out of the system. Do you have any more information on that and what that period is?
Well, that's what we're posing to our lab people and our scientists. I know Dr. Yaffe will be taking place, part of the special advisory committee of the Chief Medical Officer of Health, and the whole network has a technical advisory committee that's going to have their first meeting today. That's scientists across the country to look at questions like that. When you have a positive test, how long does it stay positive? When it's negative, the two negatives, we're assured that if you have two negatives and beyond 24 hours apart, does that mean you're totally cleared? And as you heard in the London case, where they found the weekly positive on the more advanced testing, there was a sense that the viral load is extremely low. But then, do we know what the viral load is as compared to presence of pieces of RNA from residual or damaged virus that has no virulence or no infectivity? So that PCR just picks up pieces of RNA. They may be from living virus or they may be from dead viruses. So how do you equate that into infectivity versus that? And these are questions we're trying to ask our scientists, and to say, can you deliberate that and come up with answers? We know that it's extremely low, and especially after 14 days, it's not a problem. And when you have two repetitive negatives, especially with what Dr. Allen said on Friday, even at PHOL with their more sophisticated test, we're pretty strong that a negative is definitely a negative. It's these other ones that may be in the gray zone. If we find one like London again, what do we do that, and can we be definitive on our assessment? Are they infective or not infective at that stage? So that's more of an unusual case, and we're trying to get those answers from our scientists, and that's something that Dr. Yaffe is going to have to address with the Technical Advisory Committee of our national committee on that basis.